Tonight marks 1 year since Knox County renewed its contract with ambulance provider American Medical Response, despite months and months of long wait times. Good evening. Thanks for joining us for WVLT News at 10 on the CW. I'm Casey Wheelis.
I'm Ted Hall. Glad you're here, folks. Tonight, AMR presented its one-year report to the county. AMR saying all signs point to improvements, but there are some other signs out there as well. Sam Luther is joining us here. Sam, there are improvements, but still work needs to be done.
Yeah, guys, over a year ago, there were multiple members of the Knox County Commission who raised concerns over AMR's long response times and overall workflow. Tonight, AMR says over the past year, they've worked to make improvements.
A year of progress, and that was kind of our goal all along, was progress over perfection.
A new contract between Knox County and AMR aimed at getting an ambulance to you faster. It required AMR to respond to the most serious calls within a specific time frame 90% of the time. It gives them 10 minutes to respond within city limits and 20 minutes throughout the county. AMR didn't meet those requirements in all zones until July. Officials with AMR say they took the first 90 days of the contract to analyze data to make changes.
People solves a lot of the problem by having more people on the trucks and more ambulances in the system. Certainly is a key contributor.
They've increased paramedic staffing by almost 50% and are bringing on more people full-time, which has helped them respond faster. AMR also changed the way they prepare for emergencies after looking closer at where they had gone wrong in years past.
There was a lot of changes, stuff that we'd never really looked at before, measuring different zones and different priorities per zones.
AMR says with more staff, they've been able to have more ambulances ready to respond, stationed strategically in areas where calls happen most often. They've also added a program that works like telehealth for people who may not need an ambulance.
We see about 4,000 calls a year are rolling through that 911 nurse navigator now. And of those 4,000, about a third of those don't even require an ambulance to transport.
Since July, they've met the required 90% threshold for all zones 5 out of 7 months, resulting in almost $250,000 in fines. County commissioners urged AMR staff to not get comfortable.
Overall, it's just don't take your eyes off the goal and continue to push forward and make sure that we're providing the best care to the citizens and the visitors who truly deserve it.
Yeah, AMR says some of the delays are because of long wait times at hospitals, whether their ambulances can't load patients off right away. They say meeting with hospitals and other medical leaders in the county has helped. But guys, just getting on the same page, checking in more routinely, I'm told, has been a big help so far.
Appreciate it. Thank you, Sam.
More